Hi, I'm Alice, and this is my 28th amendment. Okay, so my amendment is the cost of healthcare as well as the cost of EMS services should be reduced. So for reasoning, the 28th Amendment could help people invest in their health issues, avoid avoidable hospitalizations, and lessen overuse of the state's overburdened emergency room system by providing more residents with healthcare and lowering EMS provider rates. So, for our data, reducing the cost of emergency medical services contributes to lowering the overall cost of patients' treatment, easing the financial pressure of paying a large sum of money, and reducing avoidable emergency visits. So, according to Dr. Melissa Welch, she said, "We've seen great change since the initial first round of the funding in 2003. Which the 7 programs financed in 2003 improve the efficiency of connecting frequent user patients to the various community-based services they need to treat their treatment emergency, reducing the need for hospitalization." So, for the second data to support, it's primarily data from Santa Clara County Pilot Project show a 41% decrease in ER visits and a 43% decrease in hospital admissions. So, early reports from 2003 implementation grant in Santa Cruz County suggest similar outcomes, including a 46% decrease in clients' demand for and utilization of emergency services. So this both support my reasoning. And then the last one is community paramedicine has since been shown to decrease readmissions and hospitalizations, saving hospitals a large amount of money. This guarantees that contributing to the funding of the programs that can support them in fulfilling this aim in their best interests. Okay, moving on to oppositions. Many EMS workers are already underpaid, so reducing the EMS pricing could result in them feeling a lack of appreciation for their work, plus the cost of equipment. Aside from equipment needs, there's also staffing needs. So, according to Scott Moore, the Human Resources and Operations Consultant at the American Ambulance Association, when you need at least 2 field providers per ambulance working at any given time, so like 24 hours, and all 7 days of the week, the cost can be staggering. Added to our reasoning, added to the opposition, according to Brian J. Marquez, a retired New York paramedic and professor, has done peer-reviewed research on EMS workplace dangers in the United States and Australia. EMS is a much more dangerous occupation than previously recognized. And lastly, according to McGill research, the average EMS worker is about as likely to be killed on the job as a firefighter or a police officer, and is more likely to be injured. So there are a number of factors that contribute to the high cost of EMS, and these are the most important ones. Okay, for our polling, we asked a student of Clayton Valley High School 3 questions. Have you or someone you know that has spent a significant amount of money for EMS even though it was a big incident? EMS stands for Emergency Medical Services, a system that provides emergency medical care. So this is the result that we got. And then the second question is, does the cost of going to the hospital ever factor into whether or not you might go to the hospital with a serious concern? This is the result from our questions. Okay, lastly, have you ever called the EMS after realizing that you're gonna spend more money on top of your medical bills? So, as our analysis, Analysis. The students and 3 adults voted similarly in having to spend money, even though it wasn't a big problem. Not calling the EMS because they knew it was too expensive, but were split when the cost factor resulted in them deciding to go to the hospital with a serious concern. 2 of the adults' thoughts were the same, but one of them just had one different question difference. Okay. So, for our, like what it would look like for the people who will pass this amendment. So, the blue is for pass, and then the red is against. But there's also swing states, so they can, depend. So, our amendment will most likely pass in blue states, although it will be less likely in red states. Okay, for our analysis, after careful research on why healthcare and EMS pricing should be reduced, data shows that by lowering the overall cost of patient treatment, easing the financial pressure of paying a large sum of money, and reducing avoidable emergency visits, it can help patients to save money while still reducing the hospital workload. Furthermore, they would not have to be concerned with finances in the event of an emergency. This amendment should be implemented by the government to mandate the EMS system to reduce the cost of emergency transportation, enabling government to use the remaining funds for the healthcare problems.